Cone Health has been following a phased-in approach to resuming elective surgeries and procedures, keeping safety top of mind. So in today's two-year well-being, we are breaking down phase 2 of this approach. Cone Health's chief physician executive, Dr. Bruce Swords, is joining us now. And so first off, let's just explain what phase 2 is.
When we started thinking about reopening and performing more elective procedures, we developed a phased approach, so phase 1, 2, 3. And when we started talking with that language, we realized that it wasn't terribly adequate. And so we still will slip into the phase 1, 2, 3 discussion at times, but now we're really focused on what procedures and what volumes are we capable of providing safely this week, next week, and we're making week by week decisions about what procedures we're doing at which one of our facilities.
All right, so you are doing it week by week, which means that, if you were told, 2 weeks ago that your elective surgery couldn't be done, it may be able to be done in another 2 weeks or so. You just have to keep checking back. Talk about how Cone Health determines that it is time to move forward from 1 week to the next.
Throughout this process, we have chosen to base our decisions on 4 metrics, really. One is, are we capable of taking care of the COVID patients that present to our emergency departments and are admitted to our facilities? So do we have the capability of taking care of them, and how many patients are we taking care of at one time? So that's really our first metric. And then in order to support that work and all of the other work that we need to do, we want to make sure that we have appropriate personal protective equipment, PPE. We need to make sure we have enough testing and the people who can do the testing. And then we have a significant body of work focused on, do we have enough staffing, physicians, nurses? Do we have enough ICU beds? So really this whole idea around capacity is what we're focused on. So those 4 ideas. How many patients are we taking care of? Do we have PPE? Do we have testing? And this whole idea around the right capacity.
And some of that has nothing to do with the community, but some of it does have to do with the community and the role that we play.
Absolutely. In fact, maybe all of it has to do with how we behave and what we do as community members. And so if we are doing what we're supposed to be doing in regards to social distancing, wearing a mask, washing our hands, performing other hand hygiene, those are absolutely the things that community members can do. In addition to that, which we've heard for a long time now, the other thing our community members can do is come to the hospital and seek care when you need it. If you're suffering from a medical emergency or some other medical urgency, it's an emergency because time's of the essence. So seek medical care now. Don't be concerned about COVID, because our health system, our facilities, our offices, our hospitals are all safe.
And a lot of that comes into play when people are having shortness of breath, any kind of like stroke-related illness, that kind of thing. You do not want them to even think twice about calling or coming.
That's right. Significant injury, symptoms of a stroke, heart attack, shortness of breath, all those require immediate care, and don't stay at home, because some of these things need to be fixed now or they can't be fixed.
Is there anything else community-wise that we can do to get ready for those elective procedures that we're all hoping to have?
I think the safest thing to do when you're going to schedule an elective procedure, one is take care of yourself, be healthy, eat well, exercise, do all of those things. From a COVID perspective, think about really staying away from each other and wearing a mask. So don't go outside of your home for as long as you can prior to the procedure. If you do need to go outside, wear a mask. Pay extra caution to quarantining yourself in some sort of fashion before the elective procedure.